Every year, more than 21,000 people in the U.S. are diagnosed with brain cancer. Many will die within a year from that diagnosis. But as ABC 6 News anchor Nicole King tells us, Mayo Clinic doctors are hopeful that a chemotherapy drug approved to fight other types of cancer may help people with brain cancer live longer, fuller lives.
Every 2 weeks, David Rose spends 3 hours at Mayo Clinic receiving chemotherapy for a brain tumor called a glioblastoma. He started the experimental treatment about 9 months ago.
And I said, well, this is pretty much your last chance. We'll see if this works or not.
Standard treatment, surgery, radiation, and other types of chemotherapy worked for a while, but the tumor kept coming back.
His tumor was very aggressive when it came back. It was dividing at a much more rapid rate. We thought it was pretty much the end for David at that point.
But Dr. Kurt Jekyll says a chemotherapy drug called Bevacuzumab, which is FDA approved for colon and lung cancer, has reduced David's tumor to the point where you can't see it on an MRI.
It's gone. I mean, my tumor's gone.
Tumor growth depends on blood flow from nearby vessels. These vessels grow into the tumor after receiving a signal from the tumor. That signal is a protein called VEGF. The medication David receives blocks the VEGF from attaching to receptors on the blood vessels. Without the signals to grow, the tumor can shrink.
It went from the size of a little bit about an orange to nothing.
This drug has not yet been approved by the FDA as a brain cancer treatment, but research suggests that it could be effective for more than 50% of the people who use it.
The jury is still out whether this really will benefit and translate into patients living longer, staying disease-free for a longer period of time, but we're all excited.
Excited for David, who's living a normal life while battling a deadly disease. Nicole King.